A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant setback for both parties, the Senate failed to advance a Republican healthcare plan on Thursday, resulting in a 51-48 vote that highlighted the deep divisions in Congress over healthcare reform. The proposed legislation, backed by GOP Senators Bill Cassidy from Louisiana and Mike Crapo from Idaho, aimed to allow Obamacare tax subsidies to expire while expanding health savings accounts. However, it fell short of the 60 votes needed to advance, with every Democrat voting against it and only one Republican, Senator Rand Paul of Kentucky, breaking ranks to vote no. This failure comes at a critical time as the enhanced premium tax credits under Obamacare are set to expire at the end of 2025, leaving millions of Americans facing potential increases in their healthcare costs. The Cassidy-Crapo plan was designed to redirect federal subsidies that currently benefit insurance companies, instead proposing that these funds be used as direct contributions to health savings accounts, HSAs, for individuals purchasing insurance on the Affordable Care Act, ACA, marketplace. An analysis by the Kaiser Family Foundation indicated that this shift could help defray out-of-pocket healthcare expenses for consumers. In contrast, Senate Minority Leader Chuck Schumer criticized the Republicans, stating, "Democrats did the work, but now Republicans chose the consequences," following the dual healthcare proposal's failure. The Senate's inability to pass either the Republican plan or a separate healthcare proposal backed by Schumer underscores the ongoing struggle in Washington to address the rising costs of healthcare, which are projected to increase significantly in 2026. The failure of the Republican plan was not unexpected, as it had been met with skepticism from both sides of the aisle. While Republican leaders have long criticized the ACA, they have struggled to present a unified alternative that addresses the concerns of consumers. Senator Josh Hawley of Missouri expressed a willingness to support any measures that could immediately lower healthcare costs, emphasizing the need for practical solutions rather than perfect plans. Meanwhile, the Democratic plan, which sought a straightforward 3-year extension of the expiring enhanced subsidies, also faced an uphill battle. Only a handful of Republican senators, including Susan Collins of Maine and Lisa Murkowski of Alaska, supported the Democratic initiative, leading to a largely party-line vote. As the deadline for extending or replacing the subsidies approaches, both parties are under pressure to find a resolution that will prevent millions from losing access to affordable healthcare coverage. The ongoing debate over healthcare reform is likely to continue, with both sides acknowledging the need for action but struggling to agree on the best path forward. The stakes are high, as over 20 million Americans currently rely on the subsidies that are at risk of lapsing. Without immediate action, many individuals and families could face significant increases in their healthcare premiums, exacerbating an already challenging situation for those struggling to afford medical care. As Congress grapples with these pressing issues, the future of healthcare in America remains uncertain, with millions of Americans anxiously awaiting a resolution that could impact their access to essential services. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.